today to discuss the difficulty it is being tested. Tim came to me approximately about 3 to 4 days ago, or maybe 6 now that I'm thinking of it, with the possibility of being exposed or needing to be tested for the coronavirus. Initially, Tim had vague symptoms. He did have a relative that had just came back from China, and he came to me at that initial point to be tested. We presently had ran out of tests at that time. Tim has continued now to have symptoms even with medication, and he's now here to be tested. The reason that we're bringing this to the public at this particular time is to talk about the difficulty it is of being tested and the shortage of test materials, and so we can also understand from the patient side some of the agony they're going through during this coronavirus. Tim, will you tell us about some of the experience that you've had?
Well, I've had a fever since for at least a week, and it's body aches, fever, many symptoms. And I came to Dr. Allen on Friday, and at the time he didn't have tests. He gave me some medications, some antibiotics that we thought would work but didn't. And I still have symptoms. On Sunday, I ended up going to the emergency room because I started feeling shortness of breath. And I spent about 3 hours there. They gave me a chest x-ray, but they did not give me a test there either, even though I'd had symptoms and shortness of breath. And now it's going on day 7, and I'm very happy I was able to get a test from Dr. Allen.
So the idea here is there's a shortage of tests. The idea is also here that we're in this community on the front line doing our best. As I told Tim, I literally had to go and pick up 2 tests from another location, and of which I will be giving back to them tomorrow, just to make sure I stand up for the community and be here for those individuals that need me. Tim, I'm going to ask you to lay back now, and we're going to test you. I'm going to take your mask off there, Tim. I'm going to go to the back of your nose. Very simple. Yeah, you're good, Paul. Good job. Good job. You did perfect. You did perfect. You okay?
All right.
All right. Here we go. Good deal. Now sit up for me, Tim.
Okay.
All right. Hopefully I didn't hurt Tim, as the swab requires you to go to the back of the nose to get a good swab. The test results will be back in about 4 days. I do thank you for letting the audience know how difficult it is to be tested because of the shortage of testing material, but how we plan to stand for the community on the front line to make a difference as much as we can.